And welcome back to this session where we are talking about mental health. We've had a discussion previously with the external psychologist. We've spoken to our EHW component head, General Temba. We've spoken to an operational member. Right now, we've invited Polmed into the studio to talk to us about what they offer in terms of the services that we can expect from Polmed. In studio, we've got Dr. Malebu Majatlad. Welcome.
Thank you so much, Brigadier.
So maybe let's talk about Polmed and its offering. We were talking about mental health, and the first question is always about how much does this cost me if I were to go outside of services that are offered in the organization? What do you offer in terms of mental health awareness as well as the products?
As Polmed, we appreciate that mental health is a big challenging concern in the SAPS environment. We have therefore developed and embedded in our product offering multiple points of care that members and their beneficiaries can utilize in addressing any identified and diagnosed mental health conditions. To provide better clarity on that, we have chronic medicine benefits where members, once they've been diagnosed by a professional, can gain access to our list of drugs, which we call a formulary, that the scheme pays at no additional cost to the member. And we do not limit the RAND value that we pay for that medication. We also provide out-of-hospital services. If a member needs to see a psychologist, a psychiatrist, or a counselor, we also provide those services to the member at no additional cost, and it does not impact their day-to-day out-of-hospital benefits. And where it is necessary for a member to be admitted to a facility, we also provide benefits that cover for, at a minimum, 21 days in hospital service. And if there's a need for additional days, we also will approve that on a day-to-day and case-by-case basis. So that is but just an overview of the benefits that we provide for mental health conditions.
So maybe just to zoom in specifically to some of the specialized areas. So when you say you provide this cover, would it mean psychologists, psychiatrists, social workers, or any other person dealing in mental health? What are the specialized services that you are talking about when you say you provide that support?
Okay. So we have a network of mental health providers that have a national footprint, and these providers are specially trained to deal with mental health conditions. So we initially have counselors, and we have psychologists, psychiatrists, and we will always involve the general practitioner, who is the gatekeeper to members accessing a lot of services. So we have this network of providers out in the market that engage with our members. But internally, we have psychiatry nurses that engage with our members, those that we've identified as having a chronic condition, chronic mental health condition, and are registered on our program. We then allocate specialized nurses that then contact and follow up with the member, ensuring member is taking their medication, member is seeing their counselor or their doctor, and also checking on the family unit as a whole, because we do not think that the member exists in isolation. There is a family behind every member, so we ensure that we provide holistic care to that member and the family.
And while you're talking about that holistic care, we recognize that mental health it's a long-term process. It's not a once-off where you go and see somebody, they prescribe something. You might need to be on a long-term psychotherapeutic process with the service provider. Do you cover such chronic and long-term support? For example, if I had depression that requires me medication for minimum 6 months, would you be able to cover that?
We definitely cover that. So I'll start off by firstly saying the conditions that we cover. We cover for depression, we cover bipolar, we cover schizophrenia, we cover post-traumatic stress disorder. So each individual is unique as to the period of time that they will have the condition and require support and care. So we do not upfront limit care to 6 months. It is up to that individual's journey and process in engaging with their healthcare providers and so forth that we will then determine how long we're providing care. So there's definitely not a cutoff date to say 6 months or 6 weeks, that's how long. We walk the journey with you as Polmed, and we are there for you as long as you require us.
And I think there's an appreciation that our job is one that is very stressful. And so that's why we are talking about mental health awareness, especially now in October. How does Polmed include beneficiaries as well as other extended family members that might need the same support that maybe I as a member are seeking from service providers in terms of coverage for both the marine as well as the other option?
Okay. So on the marine and aquarium option, we provide the same mental health benefits. So what I've spoken about in terms of the benefits and the programs that we have, it is available to all members on both options. The benefits we provide are also extended to the beneficiaries. So if there is a beneficiary at home who has a mental health diagnosis, we also provide the same level of care. We have case managers who will follow up with that beneficiary. We approve the chronic medication, and we also do the whole psychosocial management of the individual at home. As I initially said, if a SAPS member has a diagnosis and they're enrolled on the program, we take the whole family on that journey of health. And so it's the same way a beneficiary has that diagnosis. We provide those same scope of services and benefits to the beneficiaries as well. And I'll want to expand and give an example. If a SAPS member has a diagnosis of depression, and at home it's challenging dealing with someone in the home with that diagnosis, that in itself can end up with other family members also developing mental health conditions. We will also onboard them and treat the whole family together, and rather than doing an isolated type of approach in managing and helping the member to get the care that they need. I think also I want to talk about when we speak about the holistic management, when SAPS members are exposed to a traumatic event as a group, we have what we call debriefing sessions or debriefing benefits. Each SAPS member is afforded 4 debriefing sessions per year. And these sessions are paid from what we call the risk benefit. So they don't touch the member's day-to-day benefits. And where the member has required individual debriefing, we provide that. Or where the event has occurred with multiple SAPS members involved, we can also offer group debriefing services. So we encourage SAPS members, if they ever do require that service, to please engage with us. We do provide it, and it is at no extra cost to them.
And how do you go about talking about these services with many of our members? As you know, we've got about 180,000 of our members. Some of them obviously are not on Polmed, but the majority of them that are operational are. How do you talk about some of the upcoming initiatives in terms of awareness drives, whether it's for mental health or for any other services that you are offering as Polmed?
Okay. So we have a multi-pronged approach. I will start off with the wellness weeks. As a scheme, we embark on wellness weeks in the various provinces where we spend a whole week dedicated to communicating, empowering, educating members about the wellness services that we provide. And it is at that point where we even identify some of the members that do have a mental health condition, and we refer them to the appropriate program and educate them on the benefits. We also have the scheme website where information about the diagnosis and management, and just to better understand what it is, depression is, or bipolar or PTSD. We provide that member communication on the website. We also have a newsletter that we distribute on a quarterly basis that again speaks to the mental health conditions and the benefits that the members do have. As a scheme, we have obviously our annual benefit guide. We encourage our members to read that benefit guide and better understand what it is that they are entitled to. We hear members being cautious about how they utilize their benefits with the fear that they would be depleted at a certain point. But with regards to mental health, the way the product has been designed, we do not touch the members day to day. The key is that the members must register on the program. We will cover your chronic medications with no limits, no co-payments. We will cover your hospital admission and even your out-of-hospital consultations. We cover all those services.
Yeah, it seems like there's quite a broad coverage in terms of mental health. And I like the fact that you are saying you're not just going to drop them as soon as those funds are depleted, because you have tapped into those savings, which is very important. I think just in wrapping up the discussion, what is it that we can do as members, or how do you normally collect feedback from us to improve on your service offering in terms of the products that you offer to us?
As a scheme, we are always wanting to be receptive to the members' needs. And as a result, we do conduct a member survey twice a year. We encourage members, when they do engage with us and they find out about the survey, to please provide that feedback to us. When we do the wellness weeks as well, that is another opportunity that members can then engage with us to tell us about the product, whether it is working for them, and how we can better improve it. Also, when members engage with the case managers who call them, whether on a weekly basis or monthly basis, that in itself is also another opportunity to talk to us and tell us how we can better improve the product. But as Polmed, we are always conscious of the fact that more can be done. So we are continuously looking at opportunities of developing additional mental health services and benefits that speak to the members' needs, that are easily accessible, but also that generate the health outcomes that we're seeking to ensure that members are mentally and physically well at the end of the process.
Dr. Mane, thank you so much for making the time. That
Only a pleasure.
Very insightful for you to come and share your insights as Polmed.
Thank you very much for the invitation, Brigadier.
There you have it. That's our discussion for the day. Mental health awareness. As you know, October is mental health. So that was a discussion we bring into you to make awareness and to bring to the fore issues that relate to mental health. And as we are always saying, you are never alone. There's always help out there. Please do reach out to all our EHW offices when and if you need to do so. Until next time, goodbye.